Hey everybody, welcome to Module 7. This week we're supposed to be talking about abuse in this specific patient that has come in. So with this patient, I would utilize the concepts of trauma-informed care. So my hope would be that this would provide an environment that promotes trust and respect and dignity and empowerment for this individual. While also emphasizing psychological, physical, and emotional safety. I would not only support her, but also encourage her to be in control of her care via shared decision making. And during her history, the patient had reported that her significant other forced her to engage in sexual acts against her will for money on multiple occasions. And she also is showing lots of signs of abuse, lots of red flags, especially the scarring in the pelvic area, along with many other signs. So it would be important to ask her if this sexual abuse occurred very recently, so that way we would know if a sexual assault exam for evidence collection is applicable. That's something that would be important to remember. But aside from that and the other medical care, this patient, has all kinds of things that are warranting concern, including physical abuse, not just her sexual exploitation. So in regards to screening for violence, it's important to maintain a non-judgmental attitude that is empathetic to the patient while ensuring that the patient knows that she's obviously in a safe and private place where no one can hurt her. It is important to remember to ask very direct questions with clear language, but also keeping in mind that it's essential to deliver in a gentle and compassionate manner. I would ensure that the patient knew that these are just routine questions that are asked of everyone, and even though they may be tough or sensitive, they're very important to her health. And I would address her with questions that were directed towards feelings and behaviors, as some women may not interpret certain kinds of abuse as abusive actions. So you can't just say, "Are you being abused?" I would ask her if she's afraid of her partner, because this can often differentiate between fear and coercion as opposed to common partner disagreement type behavior. I would also, maybe utilize some screening tools such as HITS or any other intimate partner violence screens. Or we can also use the direct questioning and phrasing that's talked about in Chapter 7 of our book. So on page 280, I really liked the way that these were phrases, even though it wasn't a direct, a tool per se that they fill out. It was questions and ways to phrase things that you could actually discuss with the patient. And so it talks about using, a general introduction, like I had said, about just, saying these are routine questions that we ask everybody. And it even says that you can normalize with a statement such as, many women I care for have experienced sexual violence or intimate partner violence, so she doesn't feel alienated. And you can say, have you ever experienced or are you experiencing these types of violence? And then you can provide information about confidentiality, required reporting, so you let them know, that what the law requires of us before they give any details, so they know exactly what we are required to do. And then it talks about asking about specific types of abuse, phrasing questions such as, like I had said, do you ever feel threatened or afraid of your partner? Does he or she ever do anything to make you feel bad about yourself, like call you names or humiliate you in public? Has anyone ever forced you to take part in any sexual activities that made you uncomfortable? She had already kind of alluded to the fact that that was something that was going on. Has your partner refused to use a condom, taken away your birth control, or forced you to have an abortion? We know that this patient does have a history of abortion, so that might be something that has occurred. Would be an important and relevant question to ask her. And then it also says, has anyone ever slapped, punched, kicked, bitten, or otherwise hurting you? So I think these really specific questions are important because that way you're not relying on the patient to interpret what abuse is. You're asking very specific questions that she can answer yes or no to and kind of provide details on that. So in addition to assessing and caring for this patient that's experiencing these traumas, I know it's also essential that we provide and set her up with resources because, we can know about the abuse, but we have to be able to help her do something about it. And it's, it talked about in our book that many patients don't show up for follow-up, so it's really important to get her set up with these resources now, immediately, effective immediately. So I would ensure that I or social services has offered her information and resources about housing and counseling and support services, hotline numbers. And then I think it's important too to know that some patients are not going to be in the stage where they are ready to accept help, and you can't force anyone to do it. So, after you've given them this safe place and given them the opportunity to reach out and to take these resources, sometimes they're still not ready and you can't force them. And so you want to make sure that they have this information. So I'd make sure she would take the information talked about in our book about there are, you can do a tiny card with a little bit of information on it about where she can get help. And then that's something that they can tuck away in a private place, such as in their shoe, underneath their foot, so that way they have access to those resources or those hotline numbers should they change their mind, so that they could take that little bit of help with them and have a resource even if they're not accepting all of the resources. And above all else, I think it's just important to ensure a trusting environment for this patient where she feels like she can come to us for help, and really encourage her and let her know that this does not define her and that there is help available and it's possible to get out of this situation, and that we can help her do that because she's not alone. So, thanks for listening, guys.